When you think of fall, what comes to mind? Falling leaves, cooler temperatures. I bet you see a lot more people sick with either a cold or worse, the flu. But those aren't the only people worried about it. WTVA's Veronica Mejia talked to a doctor about the rise in RSV cases. She joins us live in Union County with what people can do to prevent it.
RSV is a contagious virus that infects the respiratory tract and causes cold-like symptoms, but it affects everyone differently. For healthy adults and older children, RSV can seem like a simple cold. But young kids and the elderly are more likely to experience the more severe symptoms.
Wheezing, shortness of breath, low oxygen saturation, struggling to breathe.
That more than likely leads to a trip to the hospital. Why are we seeing a rise in cases?
We don't know exactly why. Certain years are worse than others. The virus may mutate, different strains of the virus similar to what flu.
There are vaccines that can help prevent some people from catching RSV. Those include the elderly, folks with underlying health conditions, and people who are pregnant. There's even a shot available for infants, but that doesn't mean you can't catch it, even if you get the shot.
It can lessen the severity of symptoms, and the goal being to keep the child out of the hospital, and the same with the vaccine for adults.
And Dr. Browning says if you catch it, you might have to deal with it for a bit.
Symptoms can last anywhere from kind of 5 to 7 days, especially the cough. That's usually one of the last things to resolve, and that can take as much as a week to a week and a half to fully resolve in most people.
Over-the-counter medicines can alleviate mild symptoms, and like they would if you had the flu. Now, Dr. Browning says you should wash your hands and stay away from folks who are sick or showing symptoms. Live in New Albany, Veronica Mejia, WTVA 9 News.